Hi everyone, Dr. Nemechek here, and I want to review this paper that's discussing how developing COVID is actually significantly increases the risk of people developing SIBO, or Small Intestinal Bacterial Overgrowth. So this is the paper. We'll have a link to the paper in the comments section. And basically, they took a large number of people, and you can see the number is in the hundreds of thousands. And they started looking and comparing between people who had COVID and those who did not, and who developed SIBO in that time. And so a month after, this is a month after COVID, this is the odds ratio. So few you can't calculate them. Month 3, odds ratio is 1. That's about the same. There's no difference here. This is month 6, about the same. Now, once you get past month 6, up until like month 12, suddenly huge jump in the likelihood of developing SIBO. So here, 30 to 39-year-olds, that's a 2.7. So you're 2.7 times more likely to have SIBO after COVID than if you didn't have COVID. This means that for every 10 people who get a SIBO without COVID, you're going to get 24 people getting SIBO after they've had COVID. All right, so basically it's increasing it. Now, the interesting thing here is, why does it take that long? Well, if you go back to my other videos about long COVID, what happens is in about 25% of everybody after they experience COVID, they develop COVID leaky gut, a prolonged release of inflammatory cytokines that has all sorts of physical problems, joints, organs, so forth, but neurologically stresses the autonomic nervous system. Now, it can give you brain fog and low blood pressure stuff in the head, but it can also slow the intestinal tract down, okay? And that slow motility is a risk factor for developing COVID. So very well may be what's going on here. Now, there's something else though. When they looked at these patients, there was an increase also in medications that these patients were using after COVID. And so here you got chronic opioid, or that's pain medicine use, loperamide, doxycycline, or dicyclomine, diphenoxylate. These all slow the motility of the intestinal tract down, just like it was saying with the autonomic nervous system. And those all maybe they're having some symptoms that these drugs are being prescribed, and the drugs are triggering SIBO, maybe. And then we have these proton pump inhibitors, super potent acid suppressants. We all know that they increase the risk of SIBO. I mean, in other studies. So maybe whatever COVID did to make them need those medicines triggered SIBO. So there's a variety of reasons here. It's probably going to be a mixture of all of these, in my opinion. It doesn't really matter. What matters is we got to deal with SIBO because it's contributing and prolonging the chronic inflammatory state. So in all my new patients, now adults, I'm treating everybody with glutamine to stop the COVID leaky gut, and I've given everybody at least a 10-day round of rifaximin to get rid of underlying SIBO. Seems to be a pretty potent combo in getting people to turn around. So that's all for today. Everybody take care of your kids, take care of yourselves, keep your inflammation down. Until next time, this is Dr. Nemechek. Take care.